Hello, Nick. Hey, it's Kim.
Hi Kim, how are you?
I'm good, thank you. How are you doing?
Not too bad at all. Thank you for agreeing to talk through this stuff. Anya, our kind of marketing person, is keen to put something in our newsletter about the staff surveys, and you were the most recent person to have done one, so I thought you'd be the perfect person.
Oh, that's great. No, I'm more than happy actually to give some feedback. So, yeah, we found it really useful. So, yeah.
Great. Good. So I sent you the questions over just so that you had a kind of idea as to what I was going to ask you, because I know there's
Mhm.
nothing, for me, there's nothing worse than people asking you a load of questions that you don't know what they are. So I'll kind of work through them, but I think if there's other stuff you want to say and you just want to kind of chat about it, that's fine, but it gives us some sort of prompts to work through.
Yeah, that sounds good.
Excellent. So to start with, and some of this stuff will seem a bit forced because we talked about it and I kind of know, but what made you decide to do the staff survey?
So when I got to the clinical survey, I think what we started to notice was that generally the outcome and feedback measurement had decreased over the last couple of years. And it used to be actually really quite good. And then over time, I think as other things came into place, and especially as I think just busyness into place, that had decreased. And that generally staff was quite unmotivated, I guess is the best word, to complete outcome measures and do this as a routine thing. And the other thing that we were really noticing is that many of the systems we use to capture how we collected our data and also our outcome measures, they hadn't really adapted to be able to capture the measures in a way that was reflecting the type of work we were doing. So we were losing a lot of information as well. So the few times people did do it, often that got lost and never really made it anywhere, which is a shame. Um, and actually, so when we spoke, I think we just, or at least on my end, I felt quite stuck in what way to start and what way to begin, especially because our team changes quite quickly. So, and I was quite new as well. So I thought the idea of actually just hearing what my colleagues thought about outcome measures and feedback generally, and to hear their attitude. Some of them have been there for a longer time, and their experience would be really, really helpful. And also just to hear their suggestions. I think that was why I was very keen to give it a try. And I thought also to highlight any sort of areas that needed to be improved upon that I might not be aware of, because they're the ones who work with outcome measures much more on a day-to-day level with clients. And I thought it was important to hear from them early on rather than at the end of the process. That's probably why.
Thank you. That's really, really good, Kim. Really, really helpful. And so, obviously, we met and we decided that was it. This was a good thing for you and your service to do. Once we talked about it, how did you find the process of arranging the survey?
Surprisingly easy, actually. I think often when you're confronted with doing things online and technology and setting all these things up, I was worried it'd be a bit complicated. But I think what I found really good was that you already had a really well thought out template, which addressed many of the areas I was interested in. And so that you sent that through and I could just read through it and tweak it as needed for our service and what was, appropriate and what was not and add as needed. That made it a lot easier rather than me having to come up with a whole range of questions on my own, which I'm sure I would have missed things out of by doing that. And then the fact that you then had it all set up as just a simple link that I had to email out, I think that made it easier on my end as well. So yeah, that was really good actually. And I also think that maybe having an external person set up the survey rather than myself also helped in terms of the clinician's attitudes towards it because they know it comes from a body that is involved with this rather than a single
Yeah,
individual who kind of makes something up on SurveyMonkey on a whim and sends
yeah.
it out.
So, so
Yeah,
it, yeah, so it kind of gives it a little bit more status than if it was something that you just decided to do.
exactly. Yes, I think so.
Great. And so when you then, so obviously we have that communication. You made a few changes to the survey, and then we sent it out. How did you find that staff responded to being asked to complete the survey?
Um, so I was surprised to a certain extent because, as I said, the attitudes towards outcome measures aren't great. And so I thought a survey asking them to talk about it and spend their time on that would be quite a hard ask to get anyone to actually fill it out. So the fact that people did, and that a range of people did, I thought was really good. I didn't have anyone come to me and complain or say that, it was a waste of their time, at least the people I know who did fill it out. Yeah. So generally, I think reasonably positive. We didn't get obviously 100% completion, but I think the fact that a lot of them did do it was a good sign in itself.
Great. Yeah, I think, and I would agree. And was there any other feedback that staff gave about the survey? Did they say anything, that they liked, they didn't like, that they thought was missing?
Yeah, I actually had a few colleagues come up to me and say they thought this was a really good idea because it's not something they generally think about, and it kind of falls at the end of their list of many things to do, and that they just don't really have the headspace. And she said, a few of these people actually said that having questions that directly prompt you to give very quick answers, very, in a way, gut answers, that was helpful as well. So that was good to hear. And a few people said it is something that we need to talk about, and this gives it a starting platform to do that on. So I did have a few positive comments, actually. And like I said, no one came up to me and said, this is a waste of time, or I just can't do this.
Yeah.
So that was positive, I thought.
Good. That sounds really positive. That's great. So we did this. The survey was open, and then did we leave it open for 3 or 4 weeks, didn't we? And then once we closed the survey, then you were away, and then you came back and got your report. So how did you find the report?
Good. I think initially I was not quite sure what to expect, because I think reports can take so many different formats, from the very dry and not particularly useful to a bit more informative. So I think what I really liked about it was very straightforward. It's broken down into very clear sections, which are understandable to me, but also understandable to other people in the team, which I thought was really, it wasn't using too complicated language, which I thought was really important, because a lot of the colleagues that I work with are clinicians first and foremost, and not, working in data or outcomes or anything like that. So that was great. And I think what I especially liked about it was that each of the core areas that were discussed not only gave you the statistics of the responses, but they also gave you kind of suggestions and areas of consideration or improvement or additional things to think about, which were really useful prompts. And so in a way, they gave data a bit more meaning and made some interpretations, but they weren't, hard, fast. It was much more an area to consider, or something to have a think about. And I thought that was actually really, really helpful as well.
Great. That's excellent, Ken. Were there any surprises in you? Were any of the results surprising to you?
So I think, unfortunately, many of the results actually confirmed some of our beliefs. Not great beliefs, but they did confirm them. However, I think a few things did stand out. For example, the fact that not many people had training in the last couple of years, for me, was a bit surprising. And I think that was a bit of a reality check to us, that that's something that we need to be plugged in. And then some things that maybe weren't surprising as such, but we just didn't think about as much, was, for example, involving service users. And I've seen that, in other services, but it's something that hasn't really been done. And I think that was a theme that came across quite a few times, and it was something that really stood out. So that, yes, maybe not surprising and such, but it did stand out. And I think the one thing that did surprise me was just a little bit about some respondents' knowledge in terms of thinking that outcome measures, for example, aren't evidence-based, and that was quite a high percentage, or thinking that they're not particularly useful. So that I was surprised about. But again, I think it comes from the fact that many people aren't trained in that, in their clinical training. And maybe that's where the beliefs and attitudes comes from. But it's, something to work on.
Good, which kind of leads us into, so what do you plan to do with the report now?
So the first thing I decided to do was feedback, simply because one of the things that stood out to me as one of the conclusions in the report was that a lot of the staff don't feel they get feedback in terms of the outcomes of the data that we produce from the measures that they collect. I really wanted to hear them and let them know they're being heard early on. So we did a little session where we fed this back to the team. And I was actually surprised by the amount of insight that people brought with them. And they were willing to think about alternative ways of approaching things, which was really, really helpful. So that was kind of the first thing we thought about doing. And we've also had a little think about, and this is very early on, but just maybe use how we can involve service users moving forward. So whether that's doing a little group and having a few people who are keen to have a think about this, or whether clinicians in their own sessions can involve them a bit more. But I think that's something we'd like to work on as well. And something we also really noticed from the report and then from the discussion following the report was just that our service is really quite niche in comparison maybe to more typical CAM services. So we don't only really address mental health, we address quite a few other areas, and how many of the outcome measures we work with, clinicians don't like them because they feel they're very limited in capturing the work they do. So we thought about addressing what outcome measures might be most appropriate and giving clinicians and clients a bit of flexibility depending on their needs and what they think is, areas that they want to work on. So yeah, and I think also ultimately there's this project to change the data systems and the way we capture outcome measures. And I think this report will be very valuable in helping feed into this project in the longer term. So I think that's the plan for the report at the moment.
Excellent. So when you shared the report with your colleagues, do you think that were there any surprises for them, do you think?
I don't know if surprises as such. I think they were surprised about some of the findings, so some of the things I brought alongside the report. So I said, for example, I can see that in terms of your motivation, it's not very high, and that's kind of reflected in our outcomes and the amounts that we're collecting. And I think they were surprised about that. I think in a way, though, it also brought the team together, and it kind of began this shifting of attitude slightly, which I thought was really helpful. And actually, as much as the session a lot of the statistics were not great at all. I think instead of walking away in a negative state of mind, a lot of us walked away thinking, okay, we need to change this and something needs to be done. And I think that was quite optimistic in a way, which was very pleasant surprise to me actually following that session. So yeah.
Yeah, you must have done a good job of managing it.
I think I have good colleagues as well who are willing to, be thoughtful when it comes to these topics. So yeah, that's good.
Good. So kind of generally, would you recommend to other services that it's a useful thing to do?
Yes, definitely. And I think even services who might be doing better in terms of, outcome measure collection and getting more feedback from service users, I think often people who are in either the management level, but also might be in the data collection or analysis role, we often make many assumptions about our colleagues, about their attitudes and what they're doing. And I think actually hearing directly from them in this anonymous bubble, which allows them to be very honest and forthright, is really helpful. And it's a way to check in at where you're at. So I would definitely recommend it, yeah.
Excellent. And if another service were thinking that they were going to carry out a survey, was there any advice that you'd give?
I think obviously something that I would always like to see more of is the more people responding, the better. So I did that by email, and then I tried to prompt people in, when I saw them as well. But I think maybe if you're ever at a team meeting together as a whole team, having it there and asking it there for people to do it, to just find different ways of encouraging staff to fill in the survey is really important. And I think that's something that, I would definitely encourage people to think about early on. I even thought maybe of having iPads in a session, like an away day or a lunchtime session, and just circulating them and asking people to fill it in. Even those sort of things to just increase the amount of responses. And definitely I think also feedback, and have this kind of promise of feeding back early on, because I think that's what staff were very much saying that they wanted to know as well.
Yeah, that they know, so they know what's going to come afterwards, not just
exactly.
the And you moved yours, didn't we? Because you decided not doing it just before Christmas. You thought that wasn't going to be great. So it's supposed to be
maybe the timing as well. You're very right. I forgot about that. But I think just pitching it at a time when staff are at a place where they would be able to complete. And I think Christmas holidays or Easter holidays and also summers, just many people are on annual leave. So maybe getting a time during the year when a lot of people are around, and also giving them enough time to do it, because even though it's 10, 15 minutes, when you have many other urgent things to do, that seems like a lot. So just giving them many opportunities to do that I think would be helpful.
Excellent. And in terms of the survey or of the report or of the processes around it, is there anything that you think could be improved?
I think the only thing that I thought of was it would be great if there was, so for example, the report that was generated, I found really useful, but I had to work on it to make it presentable to a team. So maybe having more graphics that could very quickly show those statistics, I think could be helpful. Because it's quite wordy, and for me that's fine, and I think for people who are working with the data and the outcomes, that would be, it's not a problem at all. But just maybe having some simpler graphics that could be fed back either through a newsletter or a presentation to the team could be really helpful.
So that maybe that some of them were just quite easy that you could just pick out and put into something else, so rather than lots of things on the same page.
Yeah, because ultimately what I did was I used all your statistics and I tried to make graphs or bits and pieces out of it so that it was less, numbers and wordy, which I know puts a lot of people off. So if that resource was there, that would be really useful, I think.